take a class on general medicine as well as on your emergency ICU management. 5 questions we will discuss. Our first question is, what are the principles of medical ethics? The principles of medical ethics are autonomy. First is your autonomy, and now question is that what is autonomy? Autonomy means right of the patient for self-determination. Self-determination means patient has right to choose the doctor and to choose or receive the treatment. This is the right or autonomy of the patient. Second হচ্ছে patient choice to seek advice. Patient can take advice from another doctor. It is his right. Third, patient may refuse the treatment of the ongoing clinician. So it is their right and it is the autonomy. And doctor must empower right with some medical information. Truth telling. It is another medical ethics. Truth telling. It is essential to maintain trust between doctor and patient. So here truth telling from both sides, from patient as well as from doctor. Both should tell the truth. And third point is doctor must inform the patient regarding nature of the disease. Doctor must inform the patient regarding nature of the disease. And third point of medical ethics is your informed consent. It means participation of the patient in decision taking for healthcare. The patient must give consent to the treatment. What treatment the patient will take. And fourth is confidentiality. Confidentiality means the patient specific information is important and maintaining trust in doctor-patient relationship. Patient should have confidence over the doctor that his doctor will not any decision that is harmful to the patient. It is the confidentiality, and the patient and has another confidence over doctor is that his doctor will not open the secrecy of the patient disease and prevent unauthorized access to patient record. The patient record should not be disclosed by the doctor. It is the confidentiality. And fifth point is your beneficence. Beneficence means doctor will always do good for the patient. And non-malfeasance. Non-malfeasance means the doctor will no harm. Doctor will do no harm for the patient. And seventh point is justice. Justice means do grateful good for greater number of patients. It is the justice that patient will do good for better number of patients. So these are the 7 points for medical ethics. Second question is, what are the attributes of a good doctor? What are the criteria of a good doctor? There are 4 criteria of good doctor. One is knowledge, skill and performance. It is the first criteria of a good doctor: knowledge, skillness and performance. Doctor provide good standard of practice and care with these three objects, that is knowledge, skill and performance. Knowledge means academic knowledge, skill means an efficiency of the doctor, and performance means the how to give treatment to the patient and how to do good for the patient. Second point is safety and quality. Doctors should take proper action for safety of the patient. Doctors should take proper action for safety of the patient. Doctors should take proper action for safety of the patient. Third quality. The first quality is knowledge, skill and performance. Second quality is safety and quality of service. Third is communication, partnership and teamwork. Doctors should treat the patient with dignity, politeness and confidentiality, and doctors should work in partnership with the patients. Doctors should share with the patients. Doctors should share with the patients. And number 4, maintain trust. Never abuse your patient's trust in you. Never abuse your patient trust in you. Doctor is personally accountable for his professional practice. Never abuse your patient's trust in you. Never abuse your patient's trust in you. Patient has trust upon the doctor, and the doctor should not abuse this trust. And doctor is personally responsible, personally accountable for the patient's professional practice. So communication means the doctor should have communication with the patient regarding treatment, and maintain trust means the doctor should maintain trust of the patient in doctor, and doctor should be liable or accountable to treatment. And third points of this question is, what are the obstacles of doctor-patient relationship, or what are the barriers to doctor-patient relationship? Obstruction on doctor-patient relationship. One is your authorization. Authorization for doctor, authorization or dismissive attitude. Authorization or dismissive attitude means the doctor should not have dismissive attitude to the patients. It is very harmful for the patient-doctor relationship. And second is, doctor should not do hurry in treatment. Third, the doctor should know the first language of the patient and also know the culture of the patients. If doctor do not know the patient language and culture, that is a barrier to doctor-patient relationship. And barrier from the patient, if patient is very much anxious, that is a barrier. If patient is reluctant to discuss, that is also barrier. And misconception and cognitive impairment, and hearing and speech impediment. So patient should not be anxious, patient should not be reluctant to discuss, patient should not have misconception, patient should not have cognitive impairment or hearing or speech impairment. That is barrier. Now question number 2. What are the risk factors for fall in a geriatric patient? The risk factor for fall are muscle abnormality, gait abnormality, use of walking aid, visual impairment, arthritis, and cognitive power. What are the measures you will take to prevent fall in this patient? First is your physiotherapy to improve strength of the muscle. Second, rational use of psychotropic medication. Third, reduce hypotensive drugs to prevent postural hypotension. And third, prevent dizziness by giving injection hydrocortisone and correct visual acuity and specific drug for osteoporosis and home hazards assessment and safety education. So these are the measures to prevent fall in elderly patient. Now question number 3, critical illness. A 60 years old male presented with dysuria, low pain, and found febrile and tachycardia. His BP was 70 by 50. What is the diagnosis? Diagnosis is septic shock, and outline the management of this condition. Outline the management of this condition. General measures of septic shock. Patient should be admitted in ICU. Oxygen therapy should be given, and some urgent investigation like culture of blood, urine, sputum, and arterial blood gas analysis and X-ray chest. And specific treatment: injection dexamethasone 5 mg IV 6 hourly, injection antibiotics, and infusion normal saline and blood transfusion. Injection norepinephrine to maintain BP, injection dopamine to maintain cardiac output, regular monitoring of the patient, and transport the patient to ICU. What are the diseases that mimic sepsis? Pneumonia can produce sepsis, immunosuppressive drugs can produce sepsis, IV channel can produce sepsis, diabetes mellitus, trauma, burn. These are the sepsis risk factor or mimics. Now question number 4. Write short notes on hypothermia. Hypothermia is a condition when body temperature is reduced to 35 degrees centigrade to 95 degrees Fahrenheit. The clinical presentation of hypothermia: cold skin, shivering, bradycardia, dehydration, confusion, adduction, coma. The causes of hypothermia are cold exposure, hypothyroidism, hypoglycemia, and adrenal insufficiency. Treatment: rewarming of the body, IV fluid, maintain electrolytes, injection hydrocortisone, blood gas analysis, and maintain blood gas accordingly. Question number 4B. Mention the cause, clinical feature, and management of Wernicke's encephalopathy. Now, Wernicke's encephalopathy is caused by vitamin B1 deficiency and alcohol intake, and it is characterized by confusion, nystagmus, ophthalmoplegia, ataxia, and confusion. And it is treated by injection Fabrinex 2 vial IV 8 hourly for 48 hours, followed by tablet Fabrinex 100 mg 8 hourly. Last question of today's discussion. What is paraneoplastic syndrome and mention its different presentation? Paraneoplastic syndrome is characterized by a cluster of symptoms and signs due to distant effect of malignant tumor without metastasis. And presentation of paraneoplastic syndrome and hormonal presentation is ectopic ascites syndrome, hypercalcemia due to increased parathyroid secretion, carcinoid syndrome due to increased serotonin release. Musculoskeletal symptoms, myasthenia-like syndrome, myopathy, and neurological symptom means neuropathy and cerebellar degeneration. Renal symptom means nephrotic syndrome, and others are hypertrophic pulmonary osteoarthropathy. Oncological emergency, spinal cord compression and paraplegia. Spinal cord compression and paraplegia. Superior vena cava obstruction, hypercalcemia, and neuropenic fever. Treatment of paraplegia due to spinal cord compression by malignant tumor. Treatment of paraplegia due to spinal cord compression by malignant tumor. General measures: confirm the diagnosis by MRI and catheterization physiotherapy. And specific treatment: injection dexamethasone initially 16 mg followed by 8 mg, surgical deep compression, analgesia, and radiotherapy in radiosensitive patients. So this is the end of today's class. So I think we have already completed the written question and of Chittagong University for final year MBBS examination. And next time we will give you a routine for your blog posting class, and we'll take class according to the blog posting roster. So it will be given very soon to you. So I pray to Almighty God for your healthy life, and I hope you peacefully continue your study and get preparation for coming examination. So I hope for best. Thank you, my students. Thank you.
Thank you, sir.
Thank you.